Hi, this is Dr. Robert Chao covering ACR22 for Room Now. And today I wanted to talk about a subject, again, that places a lot of power in the patients, focusing on the lifestyle factors that could affect TNF inhibitor use and its efficacy. And this was abstract 1510. And they were looking at what modifiable lifestyle factors could enhance the use of TNF inhibitors in the treatment of axial spondyloarthritis. This was a very large European study across 14 registries, totaling over 16,000 patients with axial spondyloarthritis. And notably, these are all patients starting TNF inhibitors. Out of these patients, 29% were current smokers, 49% were current drinkers, alcohol drinkers, 37% were overweight, and 21% were obese. This study found that smokers are less likely to achieve a BASDI 50 when compared to non-smokers. They also found that overweight and obese patients were also less likely to achieve BASDI 50 when compared to patients with normal weight. And they found that out of every 100 smokers who gave up smoking, they hypothesized that a further 8 would meet the response criteria. Ironically, they also found that alcohol consumption, patients out of the 49% patients who were current alcohol drinkers, they found that alcohol consumption was associated with an increased response. Although the investigators did note that this is unlikely to be causal. I think this data reinforces the knowledge and information that we pass on to our patients. I think, myself and probably all of us spend some time with patients who we know are, smokers and who we know are not leading the most healthy of lifestyles. And we pass on this information, but I think one of the biggest challenges I face as a clinician is sometimes we discuss this. And I remember one patient, we discussed stopping smoking every time. And one time she just said, "Doc, how? How do I do it? I've tried patches. I've tried gum. I've gone to class. I can't." And I think that's still an area that a lot of us, patients and physicians included, need help on. Sometimes we don't know the best way to help an individual patient. One of the things I try to pass on to my patients who are attempting to quit smoking, I think number one, that's a great first step is initially even thinking about it. And I think studies have shown us that usually when you try to quit smoking, you're not successful the first time. It's usually the third or fourth or fifth time where patients really become, quote unquote, successful in their smoking cessation. And I think that alcohol, although not their primary outcome and what the researchers were looking for in this study, I think that was an interesting data point where they found, alcohol consumption was increased with an increased response. They don't really say for these alcohol drinkers how much or what kind of alcohol. I think if the data shows that these patients were having, let's say, 1 or 2 glasses of wine per day, perhaps that should involve another study into really looking into that. But if the alcohol consumption is a very heterogeneous group, then I would agree with the investigators that this is probably not a causal relationship. Anyway, thank you for tuning in to Room Now for live coverage of ACR22, and feel free to follow me on Twitter at Dr. RBC. Thank you.